Okay, hi everyone. So one of your patients might have a wound vac, and during your shift you might hear that it might be beeping. There might be a leak, so you would check your wound vac, see what it's alarming you. If there is a leak, it'll say that, or you can also look at the wound vac and you'll see that it's puffy, it's no longer being compressed. So if there is a wound leak, it's going to be your responsibility to follow up. It's so important that you do not leave this for the next shift, because if you leave it, it can lead to further infection, or it can also lead to further damage to the wound site. So if there is a wound leak, you're going to have to follow up. So you're going to check your orders to see what the protocol is for the hospital. So if you're going to be checking for the leak, one method is going to be, let's see, put something aside. You're usually going to cover it with a drape or with Tegaderm. In this case, we'll be using Tegaderm. And to find the leak, you're going to be using Cavalong, which is a skin prep. So the way it works, you can also have the room very quiet, and when you're looking for the leak, you can also hear it, and so you're going to have the room very quiet. So when you're looking for the leak, you're going to press this all over. You might not hear it anymore. So you're going to be looking for it, and then once you find it, you're going to see that the wound sucks in, it's going to compress, so it's no longer going to be leaking. So once you find the leak, you're going to have to cover it. So we have the leak right here. So I'm going to grab my new Tegaderm and I'm going to cover it right here. So I'll let that dry, and then I'm going to cover it here.
There you go. There.
Got it. Okay, there. So now that the leak is covered, you're going to see that the sponge and the wound vac is going to be working again, so it's going to be covered.
So today we're going to be doing the removal of the dressing. So I'm gonna go ahead and when we are going to be doing the removal, what we're going to do is there's a tip that we have to tell you guys. So you can go ahead and take the tubing. You're going to get a saline syringe, and basically what the saline syringe is going to do is raise the whole dressing. First, turn off the vacuum pump. Then you want to cut the tubing. Attach a syringe to the tubing and slowly push the saline through the dressing. This will allow the dressing to be raised, so it is easier for the removal of the dressing, along with making it less painful for the patient. So now you want to clamp and detach the syringe. Next, grab alcohol wipes to remove the drape. In addition, on the dressing, there should be a note that states how many sponges are in the dressing. This will help you keep track of how many sponges you should be taking out, so that nothing is left behind in the wound. You don't want to leave anything behind in the wound, making sure that everything is accounted for. After everything is off, place in the appropriate waste container.
So if for some reason you were unable to find the leak, you actually want to remove the wound vac dressing off completely. You do not just want to turn off the machine and leave the machine off and on the patient for hours. That can lead to infection. So you're going to want to remove everything, and you are going to prepare a moist dressing on there. So you're going to make sure you're packing the wound, making sure you're packing it into any tunneling, any undermining, making sure everything is well protected. This is just going to help you keep the wound site well protected until someone can come in and they can actually apply a whole new wound vac dressing on there. After you are done, you are going to want to cover it with an abdominal pad. We did not show it on the video, but of course you want to apply some skin protectant on there before you apply the tape. And you want to initial, time, and date the dressing once you are done.
In this part, we will be preparing for a new wound vac dressing. Before preparing the new dressing, examine the wound bed. It should have pink-red granulation tissue. Note any drainage, tunneling, and undermining. Assess the wound size. A measuring tape is included in the kit. Next, cleanse wound bed with normal saline or wound cleaner to remove debris. After, use dry gauze to pat dry. Make sure wound edges are clean and dry. In this specific example, there is some tunneling and it would need to be packed. You can use Prisma. But we did not show the tunneling in this video, but it is important to keep that in mind. There is bone that is exposed. It is important that it is not covered by the foam since it can merge together. Make sure to cover with an approved dressing like Mepitol 1. Foam should never cover bone, tendon, or ligaments.
Now we are ready to open the kit. You want to make sure the foam does not touch any surfaces other than the packaging kit. From left to right, we have a track pad with tubing, we have a semi-permeable drape, we have the foam, and we also have a ruler for measurement. The next step is going to measure the wound site using the wound drape. We want to make sure we apply skin prep to the area where the drape will be covering to prevent any skin injury from happening. Next, you can apply the semi-permeable drape over the wound with the one facing down for this specific example. Now you want to trace the wound size with the marker, and you are going to cut it out with scissors carefully to the appropriate wound size. Next, you're going to place the semi-permeable drape over the wound and you're going to measure approximately 1 to 2 inches out from the border of the wound in the shape of a square and cut it out carefully with scissors. Now we are ready to apply it, so follow the numbers for the ease of the application, starting with removing layer number 1. While I was applying the drape, I noticed at the bottom there was a section that was just not sealing, so there is a possibility of there being a wound leak where I'm pointing at right now. So whenever you're applying a new dressing, you want to be aware of this being a possibility. So we will come back to that in just a little bit. Now we can get the foam ready. We are going to cut and shape the foam to fit the size and shape of the wound. Also, do not cut the foam over the wound so that you can avoid bits of foam from falling into it. And then when you are finally putting in the foam, you want to make sure that it's not forcefully inserted into the wound. You also want to note the number of foam pieces that are placed into it so you can document that. Now we're going to be placing an additional drape over the wound to seal the foam. You're going to measure 1 to 2 inches out from the border of the wound and you're going to carefully cut it out with scissors. After, you're going to place a drape over the wound to seal the foam by removing the layers as before. After we applied the 2 layers, there is still a possibility of there being a leak at the bottom. At the bottom, it just was not sealing. So what we're going to do, we're going to remove it with scissors in order to smooth out the edges. Now we are ready to apply the track pad. We're going to begin by cutting a 2 centimeter quarter-sized hole in the drape above the foam. We are going to apply the track pad over that hole in the drape, and we are going to have the tubing arranged in a direction and position that is comfortable for the patient and avoids excessive pressure against the skin, and we can finally connect it to the vacuum pump.